So that's obviously one of the challenges that's presented, is that privacy and safety concern. But what other challenges have you noticed with using AI during this time?
Well, it's part of a broader trend of adoption of AI in our field, clinical machine learning, into practice. So physicians by nature, and I don't think anybody out there will be offended or dispute this, are conservative. They have to understand that something works before they bring it into their practice, because lives are at stake, and if you use unproven technology or approach, you stand to do harm. So we're very, very careful about that. And typically there's a mountain of literature before a new diagnostic or therapeutic approach is adopted. So AI is right in the middle of this adoption curve. And I think clinicians are starting to understand that, first of all, there's so much data now that it's not humanly possible for them to practice efficiently and just sort of process all this information and make the best actions for individual patients or for population health purposes. So they are starting to acknowledge that they need computer help. There's sort of this debate in medicine about AI replacing physician judgment. We don't have this view at Early Sign. We think it's only going to serve to augment and make better clinicians by putting the most relevant information and insights in front of them at the most appropriate time. So they have to get more comfortable, and I think there's somewhat of a generational thing here. I think younger doctors are probably a little bit more comfortable with this approach. But over time, I think you'll see more and more machine learning augmentation occur. Now, there is one particular barrier that's somewhat unique to machine learning versus other medical technologies that have been adopted, and that's often referred to as the black box problem. That some algorithms, it's hard to understand how they make the choices they do because it's so mathematically dense. And clinicians are trained to understand that, okay, a patient has this disease state because of these symptoms, these findings, these lab results, and so on. So it doesn't necessarily jive to have this explanation that they can't easily understand. At Early Sign, and I know other academics and vendors are working on this too, we're working on explainability features that uncover some of the signals in a particular algorithm and explain at least partially why a patient landed on a high-risk list in a way that's acceptable to a clinician. These are the clinical factors that landed this patient on this list. It's never going to be, I think, 100% easily explained, but we're going a lot of the way there so that the docs are more comfortable with it and so that they can have more meaningful conversations with their patients, right? Because remember, the doc's the one who's in the room, they see machine learning insight, and now they have to explain to their patient why they're ordering something or making a recommendation based on that. So shared decision-making between docs and patients also requires a degree of explainability.